Hello, good morning. It's 30th of December. It's Andy. It's Andy's 5-minute rant. Sometimes they're shorter, sometimes they're longer. Please like, share, and subscribe to YouTube. Corridor care in the UK. How about dying on a corridor, in a bed, on a trolley? The UK NHS corridor care refers to the unsafe and undignified practice of treating patients in hospital corridors. Storerooms, you've got it, or other unsuitable areas due to overwhelming A&E demand, accident emergency, lack of beds, and stretched social care, leading to compromised patient safety, dignity, and severe staff burnout, with major health bodies like the Royal College of Nursing, the Royal College of Physicians demanding urgent action. Yeah, that doesn't sound very good. And one report suggested a person said, "Look, I fear dying in a hospital corridor. Hospices are being forced to cut capacity and let go of staff. It means some people will die while they wait for a bed to become available. The thought of dying in a noisy, chaotic hospital ward or corridor is really, really worrying to this patient." Um, and another report says hospitals warned end-of-life care crisis threatening treatment. A rising number of end-of-life patients in hospitals could affect the level of treatment carried out this winter, December 2025 in the UK. A group of regional NHS National Health Service leaders have been told. A consultant in palliative care highlighted the impending crisis during an online internal meeting of health leaders in Sussex, a recording of which has been heard. The consultant at University Hospital Sussex NHS Trust described dilemmas facing hospital managers when some patients are having to be given end-of-life care in A&E corridors and no doubt storerooms and anywhere else. The bleak assessment is likely to be echoed in other NHS regions as building winter pressures increase the challenge of trying to find hospital beds for sick patients needing care. Wow. This woman said, "I'm really worried that patients who have treatable conditions are not going to be able to get into hospital and be treated because there are so many end-of-life patients in hospital beds there." She went on to say, "We're no longer putting patients on the waiting list for transfer who are just straightforward dying, focusing only on those with complex need." And I guess this report is basically saying, but we're not going to focus on the dying anymore. What's the point? We're going to focus on the living, but hey ho, that's not fair, is it? You didn't pay your taxes, brought into this world for that. Why don't you tell me what you think? And listen to the whole video, because often I put some clips on about things. Like and share on YouTube and subscribe. Cost you nothing, and I don't earn nothing. It's not about earning any money. It's about spreading the word and getting these people to hold account. Are you in the US, Canada, anywhere else in the world? What happens in your areas? Is it the same? Or do you have a better system? Let us know. It's Andy for the 5-minute rant. You take care and have a good day.
Diolch, Llyweth. Corridor care is obviously one of the clearest signs of a health service that has been allowed to fall into crisis. Patients left for hours on trolleys and chairs, as we've heard. Staff forced to deliver care in places that are unsafe and undignified. This is not the fault of our nurses or our doctors. This is a direct result, as has been said, of 26 years of Labour running the NHS into the ground. This should indeed never happen. Questions absolutely have to be asked of how did our NHS get to this point? And let's be absolutely clear, it is the Royal College of Nursing Wales, the RCN, and the British Medical Association who are raising this alarm jointly. They are the voices of our frontline nurses and our frontline doctors. When they say patient safety is at risk and that corridor care must be eradicated, we should all listen and act. What they are calling for is entirely reasonable, recording corridor care, stopping bed cuts, a real costed workforce plan, investment in community care so we have enough district nurses and enough GPs to meet demand. These are basic foundations of a safe health system, no optional extras. I will share my own experience. I would like to share my own experience with the chamber. I was placed myself on a broken bed in a corridor for 2 nights before a room became available. I was in too much pain to care at the time, but for those caring for me said how it completely inappropriate was and kept apologising for it. Obviously, I told them it wasn't their fault and it's not them who should be apologising, but the bed was broken at a crazy angle. More concerningly, I could hear private conversations between consultants, doctors and nurses about other patients. And I was right against a curtainless window. And I wasn't alone in this experience. I saw others in the same predicament in corridors around the hospital. I was okay, but for those who are older particularly, there was no dignity and no privacy. And that's just not okay. The staff were incredible and I will forever be grateful to them. But we must ask how Wales has reached a point where this is considered normal. Corridor care is not okay. It is not safe, it is not acceptable, and this petition before us is a warning. Wales cannot continue with a shrinking capacity, a broken workforce plan, and no real grip from this government on patient flow. Corridor care must end, and it must end now. It is becoming the norm, and that's not okay. Wales deserves a health system that is safe, dignified, and worthy of its people that it serves. It shouldn't have to take a new government, a reform government, to get to grips with this, but I believe now that's what it's going to take. I thank the unions for establishing this position, signed by 10,000 plus people, and I'm glad it's reached the Senedd for debate. It's such a disgraceful state of affairs, and I look forward to hearing the Cabinet Secretary's response and urge him to take immediate action, because those patients having to suffer like this in inhumane ways between now and a change of government matter. Diolch.